Welcome back guys. Now in this video let's discuss about arteriosclerosis. So what exactly is this arteriosclerosis? In the name itself is there, arterio means blood vessel, sclerosis is hardening. So arteriosclerosis, it is the hardening of blood vessels. Okay. So this arteriosclerosis, it is divided into three types. Arteriolosclerosis, means the arterioles, the smaller blood vessels. So arteriolosclerosis, and the second type is called as Monckeberg medial calcific sclerosis, and the third type, which is very important, is called as the atherosclerosis. Okay, so now tell me, arteriosclerosis is divided into how many types? Arteriolosclerosis, Monckeberg medial calcific sclerosis, and atherosclerosis. Three types are there. Now this arteriolosclerosis, let's begin from the arteriolosclerosis. This arteriolosclerosis is again of two types. What are they? It's a hyaline arteriolosclerosis. Okay, hyaline arteriolosclerosis. It's a hyalinous deposition, pinkish deposition, or I should say, whenever you look at the arteriole, see, this is the arteriole. Now in this arteriole, you can appreciate this pink color deposition, hyalinous deposition. That's why it is called as the hyaline arteriolosclerosis, which is going to be seen in benign hypertension. In benign hypertension cases, you are going to have hyaline arteriolosclerosis. Is seen in benign hypertension. Okay, and there is one more type which is called as a hypoplastic. This hyperplastic arteriolosclerosis, it is going to be seen in malignant. Example, it's seen in malignant hypertension. Okay, in malignant hypertension, the patient is going to have hyperplastic arteriolosclerosis. If you look here, see, this is the arteriole. Now the smooth muscles, in order to protect the blood vessels from the rupture because of too much hypertension, the smooth muscles, they are getting hyperplastic. The hyperplasia, the smooth muscles are going to divide and they are giving the onion skin appearance. Okay, onion skin appearance, onion skinning. Okay, so hyperplastic arteriolosclerosis is something seen in the malignant hypertension where the BP is so much, more than 200 mmHg. Okay, so this arteriosclerosis, it is divided into two types. What are they? Hyaline arteriosclerosis, which is seen in the benign hypertension, and hyperplastic arteriosclerosis, where you are going to see the onion skinning appearance. Okay, so that's going to be seen in the malignant, that's seen in the malignant hypertension. Okay, now what exactly is this Monckeberg medial calcific sclerosis? See, this Monckeberg medial calcific sclerosis, it is going to seen in the older individuals. Older individuals. First of all, there is no big significance to it. Okay, it is seen in older individuals. What exactly happens is, we all know that a blood vessel, it consists of three layers: tunica intima, tunica media, and the tunica adventitia. Right? Three layers are going to be there. Now this tunica media, this region will undergo degeneration. Okay, medial cystic degeneration. So the media is going to undergo degeneration. Now in the area wherever there is degeneration, there is a calcium deposition. The calcium is going to come and deposit in the tunica media. As the tunica media is getting affected, so there is no problem with the tunica intima. So the lumen of the blood vessel is not going to be affected. Okay, only just in the media some calcium will deposit. Because of this calcium deposition, there is a stiffness of the blood vessels. That's why it's a sclerosis. So in the name itself is there, it is the Monckeberg medial, means the tunica media is going to be affected. So calcific sclerosis, calcification is happening. Okay, if you look at this image, okay, so this is the lumen. So here are the blood cells, these are the blood cells. Now this is the media, right? This is the area of the media. now you can very well appreciate that the calcium deposition which is happening in the media. Okay, now even in this picture, in this blood vessel, see the calcium is getting deposited within the media. So this is called as a medial calcific sclerosis. And whenever you take X-ray, the blood vessels are getting calcified. So even you appreciate here, the blood vessels are showing this calcification. So this is Monckeberg medial calcific sclerosis and of no big significance. Okay, not significant clinically. Okay, not significant clinically because tunica intima is not affected, so the lumina of the blood vessel is not going to be narrowed. Now, the last fellow which I want to discuss, the most important topic, is atherosclerosis. What exactly is this atherosclerosis? Now, look here. So this is a blood vessel. Okay. Now, in the blood vessel, there is a deposition of this lipid material. Okay. So there is a deposition of the lipid material. Because of this lipid material, what happens? See, the effective diameter of the radius of this blood vessel is going to be narrowed. So the blood vessel is getting narrowed. Whenever the blood vessel is getting narrowed, what happens? The blood supply decreases, the blood perfusion to the tissue decreases. Okay. So atherosclerosis, it is due to deposition of this fatty material within the blood vessel. Okay. Now sometimes what happens is this atheromatous plaque, this is called this fatty material, all this is called as atheromatous plaque. This atheromatous plaque, it will rupture. Okay, it will rupture and it lead to the formation of thrombus. Okay, it will form the thrombus. Now, do you know what this thrombus will do? This thrombus, it will grow. Okay, thrombus, it will grow and it will completely occlude the blood vessel. There will be a point that complete blood vessel will be occluded because of the rupture of this atheromatous plaque. That can lead to myocardial infarction. If this happens in the coronary artery, that will lead to myocardial infarction. So, the point which I want to put into your mind is simple. Atherosclerosis, it is happening in the large blood vessels, it happens in the large blood vessels and it's a deposition of the fatty material. Why fatty material is getting deposited in the wall of the blood vessel? Why it happens? That we will discuss now. Okay. Now let's begin the story. Normally, here in this image, you can very clearly see that the innermost layer of a blood vessel is called as, this layer is called as the endothelium. The endothelium is the innermost layer of the blood vessel. Okay. Now, what is this layer then? This layer which I am highlighting right now, this is called as a tunica media. Okay. And the outermost layer is called as the tunica adventitia. Okay. Now, what happens? The entire problem, it begins with one thing. Atherosclerosis, the problem is endothelial injury. Remember, atherosclerosis is a complication or atherosclerosis is a consequence due to endothelial injury. Okay. That's the point which I want you to know. So, now, why endothelium is getting injured and how that endothelial injury will lead to atherosclerosis, that I will tell you now. Okay. See, there are certain risk factors. Okay. See, these risk factors are the ones which will lead to the endothelial injury. So, now what are these risk factors which you should know? First, number one risk factor. Okay, the number one bad guy is smoking. Okay, the smoking, alcohol. Okay, see the smoking, whenever the person smokes, all this carcinogenous material, all these chemicals, they will enter into the lungs. From the lungs, these chemicals are going to diffuse into blood only, no? Now these chemicals, they have a propensity to damage the endothelial cells. Okay, now once the endothelial cells are damaged, that can lead to, okay, on a chronic basis, that can lead to atherosclerosis. So smoking, alcohol, hypertension. Hypertension can lead to endothelial injury, hyperlipidemias, are a risk factor, obesity, diabetes mellitus, and certain virus like herpes, cytomegalovirus and chlamydia. So these viral infections, especially herpes, cytomegalovirus and chlamydia infections, can also lead to atherosclerosis. And male sex, okay, male sex, type A personalities, So type A personalities, these people are very much looking all the time, alert, anxious, okay, with a lot of hypertension. So a type A personality people, older age, and homocystinemia, okay, homocystinemia. So these are the risk factors. Okay, so smoking, alcohol consumption, hypertension, diabetes mellitus, obesity, hyperlipidemias, and viral infections like herpes, cytomegalovirus, chlamydia infections, and male sex, type A personality, old age, and homocystinemia. See, these are the risk factors which can lead to atherosclerosis. First of all, what they will cause? They will cause endothelial injury. They will somehow cause the endothelial injury. Okay. Now, once the endothelial injury happens, in response to endothelial injury, see, endothelial injury, the response will come. Okay. This response is the atherosclerosis. Okay. So, response to endothelial injury is the mechanism in atherosclerosis. Now, you can see here what happens. See here, there is a chronic injury, not one time or two times. See, one time or two times if the endothelium is going to be injured, nothing is going to happen. On a chronic basis, repeated damage to the endothelial cells because, see, because of some virus, toxins, hemodynamic factors like hypertension, hyperlipidemia, homocystinemia, smoking, all these I have already discussed. See, because of these risk factors, what happens? See, there is endothelial injury. Now, once the endothelial injury is happened, see, now the endothelium is going to be dysfunctioning. Now, what happens? I will tell you. Okay, let me write in a new page. First, let's begin with the endothelial injury. Now, whenever the endothelial injury happens, that is the intimal layer. No, intimal layer is going to be damaged. Intimal damage. So, intima is going to be damaged. Now, whenever the intima is damaged, what happens? The macrophages and the platelets. The macrophages which are present in the blood, okay, the macrophages and platelets. These macrophages and platelets which are present in the blood are going to enter into the wall of the blood vessel. They will now enter into the wall of the blood vessel. They will enter into the media. Okay, so the macrophages and platelets, they will enter first. They will enter into intima. Enters into intima. Now, after coming into intima, they won't sit simply like that. Okay, they will create some nuisance. After entering into the intima, what they will do is they will start to release the growth factors. Okay, in order to heal that area, they will start to release growth factors. Release growth factors. So, who is releasing the growth factors? The macrophages and the platelets. These are the important cells. The macrophages and the platelets which are entering into the intimal layer. Now, they will start to release the growth factors. Okay. Now, let's see the same thing here. See, these green colored cells which we are showing here, these are the platelets and these are the monocytes. Monocytes are nothing but the macrophages, no. Okay. Monocytes, once they enter into the tissue, they will become the macrophages. So, these monocytes and the platelets, what they will do, see, they are now entering into the intima. Now, after entering into the intima, what they will do? They will release the growth factors. They will release the growth factors. Okay. After this, what will happen? Because of these growth factors, see, growth factors are like a nutrition, right? Now, these growth factors, they will attract the smooth muscle cells which are present in the media. The smooth muscle cells which are present in the media, now they will start to move into the intima. Okay. So, the smooth muscle recruitment will happen. Smooth muscles migrate into intima. Okay, now in the intima we have newer cells, that's the smooth muscle cells. Now this is not just the intima, this is the neo-intima. Neo-intima. This is the new intima with the smooth muscle cells. Okay, done. Now what happens is the smooth muscle cells which are present in the tunica intima. Say now a gust came, Guest came. Once the guest came into the new place, do you think it's going to sit simply calmly like that? No. It have to, like whenever the guest come into your home, what you will do? You will give some food, right? In the same way, the smooth muscle cells and one more guest is there. Okay, the macrophages also came into the tunica intima. The smooth muscle cells and the macrophages, what they will do is they will engulf the LDL. See, because of the intimal damage, the intima is damaged, no? Because of the intima which is getting damaged, not only the platelets will come, not only the macrophages will come, see some amount of other blood cells will also come, some amount of like LDL will also come into the vessel wall. See for example here, the intima is damaged. When the intima is damaged, all the things which are present in the blood, they can have access into the vessel wall. Okay, mainly the macrophages will come, platelets will come. Along with the macrophages and platelets, yes, LDL will also come. So now they will start to engulf oxidized LDL. Okay, so this is the important point. What they are doing, the smooth muscle cells and the macrophages, they are eating the oxidized LDL. So now if you look a smooth muscle cell, it is totally filled with the oxidized LDL, and if you look at a macrophage, it is totally filled with the LDL, okay, oxidized LDL. So these cells now are called as, so the smooth muscle cells, the myocytes and the macrophages which contains this LDL, these cells, they are called as foam cells. Okay, so these are the foam cells. Foam cells are seen in atherosclerosis, true. So what are these foam cells? These foam cells are nothing but the macrophages and the smooth muscle cells which are eating the fats, which are eating the LDL. Now these foam cells, okay, now a collection of these foam cells, like no, they will have a group meeting. Now the collection of foam cells is called, or they form atheromatous plaque. It forms the atheromatous plaque. Atheromatous, okay, atheromatous plaque or fatty streak. So the important point which I want to put into your mind is this fatty streak. Okay, it's nothing but a collection of the foam cells. Now the fatty streak is the one, okay, the fatty streak is the one, or the fatty streak is the earliest visible lesion. Okay, with eyes you can see this, it's the earliest visible lesion. So the earliest visible lesion in atherosclerosis is a fatty streak, and fatty streak is nothing but a collection of the foam cells. Now some important questions which you need to know for your exam are, what is the most common site of atherosclerosis? See, atherosclerosis is going to happen in the larger blood vessels. Most of the students will think that the atherosclerosis is something more common in the coronary arteries. Now atherosclerosis, the most common site of atherosclerosis is abdominal aorta. This is the most common site, number one most common site. Second most common site is coronary arteries, and the third most common site is popliteal artery. Okay, so abdominal aorta, ACP, the mnemonic is ACP. Okay, something like Assistant Commissioner of Police, right? So in the way, abdominal aorta before the bifurcation, before the ileal bifurcation. Okay, so you can very clearly see this is the abdominal aorta which is having atherosclerosis, and now it's getting dilated. Okay, even you can see here the atherosclerosis is there because of the complication of the atherosclerosis. Now there is, like, dilation and aneurysmal formation. So that's the area, abdominal aorta below the renal arteries. Okay, the abdominal aorta below the renal arteries and above the bifurcation of the common iliac arteries. So that part of the abdominal aorta is at a more risk of developing atherosclerosis. Okay, done. So let me write here. What is the most common site? The most common site is abdominal aorta below, okay, abdominal aorta, you already know it, below renal arteries, okay, below the renal arteries, and above bifurcation of iliac arteries. Okay, so below the renal arteries and above the bifurcation of the iliac arteries, that's the most common site of atherosclerosis. Okay, now what else you should know for your exam? You need to know that the least common site, the most common site of atherosclerosis is okay, abdominal aorta followed by coronary arteries followed by the popliteal arteries. The least common site, okay, let me write here. The least common site is circle of Willis. Okay, so the circle of Willis is the least common site of atherosclerosis. And what are the complications? If one have this atherosclerosis, what are the complications? See, the complications are, once if the atherosclerosis happens to a blood vessel, the blood vessel is going to become weak. Now, once the blood vessel is weak, it will dilate and forms the aneurysms. So, first thing is aneurysm, complication is aneurysm. This, okay, aneurysm. Second thing is rupture. Okay, the atherosclerosis will rupture and it will form thrombus. Okay, thrombus can happen, or because of this atherosclerosis there can be dissection of the arteries, especially aortic dissection can happen. Okay, these are some complications. I hope you can see this. So, what are the important points about the atherosclerosis? The important points about the atherosclerosis is a response to endothelial injury. What are the risk factors? Diabetes mellitus, hypertension, hyperlipidemia, homocystinemia, male sex, type A personality, and the viruses like cytomegalovirus, chlamydia, herpes virus, okay, smoking, alcoholism, all these are the risk factors. These risk factors will cause the chronic or repeated endothelial damage. Now, with the endothelial damage, the macrophages and the platelets, they will enter into the tunica intima. Now, in the tunica intima, they will produce the growth factors. Now, because of this growth factors, the smooth muscle cells from this tunica media, they will enter into the tunica intima, forms the neointima. Now, in this neointima, the smooth muscle cells and the macrophages, they will start to engulf the oxidized LDL. Now, in the smooth muscle cells, in the myocytes and in the macrophages, there is a presence of this LDL. Now, these cells are called as the foam cells, and the collection of these foam cells, okay, the collection of these foam cells will form atheromatous plaque or a fatty streak. After sometimes what happens is these myocytes they will die, and even the macrophages they will die after some time, leading to too much accumulation of the LDL over there. That's a total different thing. But these are the basic points which I want you to know. Okay, so what is the most common site? The most common site is going to be abdominal aorta. Okay, here I have shown you the three images where the abdominal aorta is getting the atherosclerosis followed by the aneurysm also. And this atherosclerosis, the problem is it will rupture. This atherosclerotic plaque, it's very weak. At any time it can rupture. Once this atherosclerotic plaque, once it is ruptured, upon the ruptured area, thrombosis will happen. The thrombi formation will happen. The thrombi can completely occlude the blood vessel. If it happens in a coronary artery, the patient might get the myocardial infarction also, right? So, these are some important points which I want you to know regarding the atherosclerosis. Hope the video is helpful. Thank you.